I want to speak just really briefly to part of why it's so important to, one, use anatomical language in having this conversation, and why it's so important to understand our anatomy. And a big piece of that is change, especially change in connection with HRT and with testosterone specifically. It's so exciting. And it's also something that is unknown because it's deeply specific to the individual. And I love seeing in the chat people talking about their beards. I've been on testosterone, I'll talk about this more later, for over 7 years, and I can barely grow any facial hair. And that's just because of genetics. And so I think it's really important to understand that everybody's body is different. What somebody experiences in terms of changes to their vulva, changes to their vagina on testosterone, is going to be and feel different. And the first step of understanding what those changes might look like is knowing what the sort of, I have called it in the past, the pre-settings, right? And so I also want to add that when we talk to medical practitioners, having correct anatomical language is even more important, because most medical practitioners who are not well versed in testosterone and in hormone replacement therapy do not understand those changes and do not know what has happened. And it is very important to be using anatomical language in order to make sure that you're getting the care that you need as well. So that's just yet another layer. But I think it is important to set the tone. And like Ray said, and like Lindsay has said, using this type of language, which is not the language that I would use to talk about my own body, but I do think is important to use when we're having this conversation more broadly. This is largely in effect from a massive change to your body. And so it's most likely to happen when those changes are at their peak. So first few months to the first few years, because even 3-4 years in, your body is still balancing out, right? And figuring it all out. And so the same way, if you think about first puberty, how long it took to balance out, that can take 6, 7, 8 years, up to 10 years, right? For you to really balance out in first puberty. So in taking HRT, it's the same thing, where when you're introducing the hormone to your body, right, it can take a couple years for your body to balance out and figure out what's exactly going on and adjust as it should and as it will, hopefully, but it will eventually adjust, but it can take time. And that's when we talk about sort of like disruption of the microbiome. Your body will eventually be like, cool, this is my new normal, but it is being changed, and that can lead to infections.
Yeah, and the one thing I was going to mention too is, and we get this from a lot of our practitioners and our visiting doctors, is they describe going on T like writing new code. Your body is writing new code throughout all of its systems. Your skin is the largest organ that is affected, your vulva, your vagina, etc. And so something to also consider is that as your body changes and you begin to introduce new things, this might be lube, this might be a different partner, sex toys, new different types of underwear, all of those things can be a new catalyst for a change you may experience. So, your body is not going to arrive in, it's like final form. And then all of a sudden you're, to be expected to be at your new normal in the first, like Clark said, couple months to the first couple of years. There's going to be changes that could be triggered by something else as you move through life and your life, your experience on T.
So yeast infections, BV, and even UTIs all show up differently for me than they did before I started taking testosterone. And that's something that, again, depending on you and your body, you will learn and you'll figure out. But this is, and we're going to talk about this in a little bit, why you need to learn how to advocate for yourself with a doctor. Because if you want to get those meds, if you want to get antibiotics, if you need to figure that out. And also why sometimes natural remedies really, really work and are going to be so much more alleviating of those symptoms than anything else. And there are a lot of different ways that estrogen and progesterone can be taken or used in a localized way. And Lindsay mentioned this earlier, that I was very wary when my doctor was like, well, let's give you estrogen. And I was like, no, because you see the whole point taking testosterone. And I can confidently say any sort of capsule or tablet that is used as a suppository, any sort of external localized cream that is estrogen or progesterone does not change your body's hormone levels. It does not disrupt your testosterone use in any way. It does not supply your body with more estrogen in any other place than your vulva or your vagina. Your doctor works for you. And if you are not getting the care that you want, need, or expect, you get to ask for it. And that was one of the things I felt myself kicking myself when I finally went to this GYN, and I sort of left this out. He asked, did your other doctor do a vaginal culture? Like, did she take a swab? Did she do anything? And I said, I felt so ashamed to be like, nope. And I didn't ask, and I was embarrassed and in pain, and, I just didn't ask for that, and I should have. But it's not about whether or not I should have. That comes into it. She should have done it in the first place. But to have a doctor remind me, you next time you experience discomfort, here's what you should ask for if it's not being done.
The first question that's on the list is, what issues do trans men going through menopause experience?
The same issues as a cis woman going through menopause. It is exactly the same. And it's largely, you can have hot flashes, you can experience severe atrophy, it's essentially the same, regardless of if you're taking testosterone or not. Menopause is menopause. Menopause is about no estrogen, right? So there's less estrogen, which is what we've been talking about, but having no naturally produced estrogen in the body. It's essentially just more drastic, more intense versions of what we're talking about, along with some other things that can happen during menopause, but it's basically the same.
Yeah, and I think it's important to know that there's menopause, and menopause is characterized by a year without a period, but that's really abstract. I don't bleed, so I don't know. I'm 35 years old. I am peering down the pipeline of menopause. Also, you can be thrown into menopause or early menopause for other reasons, but hormone replacement therapy is actually used for all type, cis women as well. And again, this is for menopause, it's a good time to think about the differences and that localized estrogen therapy for discomfort, which is such a big piece, especially for trans folks. So
let's see, this person asks, how would I find a GYN that knows how to work with trans individuals on and off T?
There are a few different avenues you can look for. Planned Parenthood or LGBT clinics in your area. But I would, and honestly, this is my go-to, is being extremely direct and asking. Find someone that you like for various other reasons, and then be like, have you ever worked with someone on testosterone before? Have you had transgender patients? Right? And if they're weird about it, or if they say no, then don't see that doctor. That is my advice. There's also the WPATH website has a long list of GYNs that are WPATH compliant.